When considering medical treatment abroad, many people start with a fundamental question. Who decides on the treatment? Is it the patient, the doctor, or the system? In this episode, we would like to discuss how medical decisions are made in Japan. In many countries, patients are presented with multiple options and asked to choose. The role of the doctor is often to explain risks and benefits, while respecting the patient's wishes. This approach makes sense, and many people naturally expect the same process in Japan. However, Japanese medicine is slightly different. In Japan, medical decisions are not based on preference. They are based on three core elements: scientific evidence, clinical practice guidelines, and medical validity for each individual patient. These elements guide doctors before personal wishes, before cost, and before convenience. Every treatment decision begins with evidence. Large-scale clinical studies, published medical research, and long-term outcome data. If a treatment has not been shown to be effective or safe, it is not considered an option, even if it is requested. In Japan, medical societies carefully analyze evidence and create clinical guidelines. These guidelines define what is considered standard treatment, what may be considered in limited cases, and what should not be recommended. Doctors are expected to follow these guidelines closely. Deviating from them requires strong medical justification. Even if a treatment exists, it may not be appropriate for every patient. Doctors evaluate tumor location and size, disease stage, imaging results, blood tests, overall physical condition. Only after this careful evaluation can a treatment be confirmed as medically appropriate. This is why some advanced therapies can only be approved after examinations in Japan. In the Japanese medical system, providing a treatment that is medically inappropriate is considered irresponsible. Even if a patient strongly hopes for it, even if the treatment is expensive, even if it is technically possible, the doctor's responsibility is not to fulfill requests, but to protect the patient. For patients unfamiliar with this system, the process may feel strict. It may feel inflexible, or even disappointing. But this structure exists to reduce unnecessary risk and avoid treatments that offer no real benefit. When this decision-making process is not understood in advance, expectations and reality may not align. And when that happens, even careful, high-quality care can feel confusing. Understanding how Japan makes decisions is just as important as knowing what treatments exist. At OpenMedi, we believe clarity comes before travel. We do not exist to persuade you. We exist to help you understand, so patients can decide, with knowledge, not assumptions. That is the reality of Japanese medicine. Welcome to OpenMedi.